After 60, the blood vessels that supply every tissue in your body, including the tissues that matter most for sexual function and urinary health, become progressively less efficient at producing the compound that keeps them open, flexible, and responsive. That compound is nitric oxide. And the good news is that 5 specific foods, eaten consistently in the morning, directly support its production in the endothelial cells that line your blood vessels. Not supplements, not medication. Foods that are in most grocery stores and cost almost nothing. Today, I am going to name all 5, explain the exact biochemical mechanism behind each one, tell you how to incorporate them into a morning routine that takes less than 10 minutes, and cover something that no other video on this topic includes. Who needs to be cautious with some of these foods because of their interaction with common medications that many men over 60 take? My name is Dr. Elizabeth Kavaler. I am a board-certified urologist and urogynecologist with over 20 years of clinical practice. Pelvic blood flow, vascular health, and erectile function are directly within my clinical specialty. Everything I share today is grounded in published nutritional biochemistry and vascular physiology research, and I will name every source. Here's the physiology you need to understand first. Every blood vessel in your body is lined by a single layer of cells called endothelium. These cells produce nitric oxide through an enzyme called endothelial nitric oxide synthase, or eNOS. Nitric oxide signals the smooth muscle surrounding the blood vessel to relax, which widens the vessel and allows blood to flow more freely. Penile erection is fundamentally a vascular event. It depends entirely on nitric oxide-driven vasodilation of the cavernous arteries that supply the erectile tissue. When nitric oxide production declines, those arteries cannot dilate fully on demand. Blood flow to the erectile tissue decreases. The result is weaker, less reliable erections that most men over 60 accept as inevitable aging. L-citrulline. After 60, eNOS enzyme activity declines due to both age-related oxidative stress, which destroys available nitric oxide, and reduced substrate availability, meaning the body has less of the raw materials the enzyme needs. Research published in the Journal of Applied Physiology has documented this age-related endothelial decline and its direct consequences for peripheral and pelvic circulation. The 5 foods I am about to cover work through one of 2 pathways. They either supply dietary nitrates that the body converts to nitric oxide through a bacterial pathway in the mouth and gut, or they contain bioactive compounds that directly stimulate eNOS enzyme activity and protect available nitric oxide from oxidative destruction. Both pathways produce the same outcome: more nitric oxide, better vasodilation, improved pelvic and peripheral blood flow. Food 1. Beetroot or beetroot juice. Beetroot is the richest dietary source of inorganic nitrates available in whole food form. A 100 milliliter serving of cold-pressed beetroot juice contains approximately 250 milligrams of dietary nitrate. These nitrates are converted to nitrite by bacteria on the tongue and in the gut, and then reduced to nitric oxide in the bloodstream, directly causing arterial vasodilation. A 2023 meta-analysis published in Nutrients confirmed that dietary nitrate from beetroot consistently improves blood flow, reduces systolic blood pressure, and improves exercise tolerance in older adults. For men over 60, 70 to 150 milliliters of cold-pressed beetroot juice in the morning on an empty stomach is the most clinically supported single dietary intervention for nitric oxide production. Do not use mouthwash within 90 minutes of drinking it. Antibacterial mouthwash destroys the tongue bacteria that perform the critical nitrate to nitrite conversion step. Food 2. Dark leafy greens, specifically arugula and spinach. Arugula has the highest nitrate content of any commonly eaten leafy green, approximately 480 milligrams per 100 grams, nearly double that of spinach. A handful of arugula blended into a morning smoothie or eaten as part of a breakfast salad delivers a meaningful dietary nitrate load that supports nitric oxide production through the same oral bacterial pathway as beetroot juice. Spinach contains L-arginine, the direct amino acid substrate for eNOS enzyme activity, as well as nitrates and antioxidant compounds that protect nitric oxide from oxidative destruction. Research in the British Journal of Nutrition confirmed that regular leafy green consumption was independently associated with improved endothelial function markers in adult men. Food 3. Watermelon. Watermelon is the richest dietary source of L-citrulline, an amino acid that the kidneys convert to L-arginine, which is then used by eNOS to produce nitric oxide. The L-citrulline pathway is actually more effective at raising plasma L-arginine levels than direct L-arginine supplementation, because L-arginine taken orally is substantially metabolized in the gut before reaching the bloodstream, while L-citrulline bypasses that degradation. A study published in the American Journal of Hypertension found that watermelon extract supplementation improved arterial function in middle-aged adults with prehypertension. 2 cups of fresh watermelon in the morning, eaten as part of breakfast, provides clinically meaningful L-citrulline. It must be fresh. Processed or canned watermelon loses most of the L-citrulline content. Food 4. Dark chocolate with 70% or higher cacao content. Dark chocolate contains epicatechin, a flavanol that directly stimulates eNOS enzyme activity through the same upstream pathway as exercise. A meta-analysis published in the British Journal of Nutrition found that cocoa flavanol consumption was associated with significant improvement in flow-mediated dilation, which is the clinical measure of endothelial responsiveness to blood flow demand. For men over 60, 1 to 2 squares of 70% or higher dark chocolate in the morning, approximately 20 grams, delivers a meaningful flavanol dose. This must be minimally processed dark chocolate, not milk chocolate and not heavily Dutched cocoa, which destroys the flavanol content during alkalization. Food 5. Pomegranate seeds or pure pomegranate juice. Pomegranate contains punicolagens and ellagic acid, polyphenols with a dual action on nitric oxide availability. They stimulate eNOS activity and simultaneously inhibit the enzyme that degrades nitric oxide. This dual mechanism produces a sustained increase in available nitric oxide that single pathway foods cannot match. A study published in Clinical Nutrition found that regular pomegranate consumption improved carotid intima media thickness, a direct measure of arterial wall health in patients with cardiovascular risk factors. 100 milliliters of pure pomegranate juice in the morning, or a handful of pomegranate seeds added to yogurt or oats, is the practical daily dose. Check labels carefully. Commercial pomegranate juice products are frequently diluted with grape juice or sweetened heavily, both of which reduce the polyphenol benefit. There's one clinical consideration that no other video on this topic ever includes, and as a urologist, I have an obligation to raise it. Many men over 60 take PDE5 inhibitors, sildenafil, known as Viagra, or tadalafil, known as Cialis, for erectile dysfunction. These medications work by blocking the enzyme that breaks down nitric oxide-driven vasodilation, which extends and amplifies the effect of available nitric oxide. Dietary nitrate sources, particularly beetroot juice and pomegranate juice, increase nitric oxide production upstream of the same pathway. When high nitrate foods are consumed together with PDE5 inhibitors, the combined effect on vasodilation can cause blood pressure to drop more than intended. In older adults, that blood pressure drop can produce dizziness, lightheadedness, and fall risk. This does not mean you cannot eat these foods if you take PDE5 inhibitors. It means you should avoid consuming high-dose nitrate foods, particularly beetroot juice, within 2 to 3 hours of taking your medication. And if you take any nitrate-based cardiac medications such as nitroglycerin or isosorbide, do not combine these foods with your medication at all without first discussing it with your prescribing physician. The interaction between dietary nitrates and nitrate cardiac medications can cause a dangerous and rapid drop in blood pressure. As a urologist, I want to connect this to something broader than erectile function, because improving pelvic blood flow through these foods does not only affect sexual performance. The prostate gland, the bladder, and the entire pelvic floor musculature depend on healthy microvascular blood supply for normal function. Men over 60 with poor pelvic circulation frequently experience more pronounced lower urinary tract symptoms, including urgency, frequency, and incomplete bladder emptying, than men with good vascular health. Improving endothelial function through dietary nitrate and flavanol intake is a systemic intervention that benefits the entire pelvic vascular bed, not just erectile tissue. The morning habits I have described today are not a treatment for erectile dysfunction or urinary symptoms. They are a foundation of vascular health that supports every system dependent on blood flow, and in the pelvis, That is a long list. Here is a simple morning protocol that incorporates all 5 foods without requiring significant preparation time. On waking, drink 70 to 100 milliliters of cold-pressed beetroot juice or pomegranate juice before coffee. Wait at least 90 minutes before using any antibacterial mouthwash. Add a handful of arugula or spinach to a blended smoothie or morning eggs. Include 2 cups of fresh watermelon as part of breakfast 2 to 3 times per week. Finish with 1 to 2 squares of dark chocolate with your morning coffee. The entire addition to your existing routine takes under 5 minutes and costs less than a daily supplement. Consistency over weeks and months is what produces measurable endothelial benefit. The research on dietary nitrates shows cumulative improvement in vascular responsiveness with sustained daily intake. Start tomorrow morning. The conversation about men's sexual health and pelvic function after 60 deserves to happen openly, with accurate information from a qualified source. What you eat in the morning has a real and measurable effect on the blood vessels that determine how well every system in your pelvis functions. That is not a marketing claim, it is endothelial biology. 5 foods, 1 morning, every day. I am Dr. Elizabeth Kavaler. I will see you in the next video.